I'm Lauren. I'm a nursing student at UAN. I'm just going to be performing some tracheostomy care on you today. Can I get you to go ahead and verify your name and your date of birth? Okay, so that is correct. So the first thing I'm going to do is I'm just going to put this sheet over your chest just in case any liquid or anything falls out. Don't want to get it on your clothes. Next, I'm going to perform hand hygiene, and I'm going to put on a pair of non-sterile gloves. And I have a biohazard bag right next to me, and I'm just going to take out this old gauze and throw that away in the biohazard bag. After I've done that, I'm going to take off these gloves, and I'm going to perform hand hygiene once again. After that's done, I'm going to put on my PPE. And I'm going to go ahead and put on a pair of sterile gloves. Okay, after that, I'm going to throw this out. Okay, so I'm going to go ahead and open my kit up. And after I open that, I'm going to take out my sterile field. After that, I'm going to get my normal saline. I'm going to go ahead and open that up, and I'm going to lip it in the trash can. After I've lipped it, I'm going to go ahead and take out all my supplies, and I'm going to set it on my sterile field. And I'm going to pour the normal saline into one of the boxes. And I'm just going to go ahead and set that to the side. After that, I'm going to get my hydrogen peroxide. I'm going to open it up and pour it into a separate box in my container. After that, I'm going to dispose of that in a biohazard bag. After I've done that, I'm going to get half of my gauze. I'm just going to go ahead, fold that, and I'm going to put it in my normal saline. After I've done that, I'm going to, after it's completely wet, I'm just going to set it in the dry part. I'm going to do the same things with my cotton swabs. So I'm just going to dip those in the normal saline, make sure that they are completely wet. And I'm going to set those in the dry part of the box also. After I've done the gauze and the cotton swabs, I'm going to go ahead and take out the cannula. Okay, so after I've taken out the cannula, I'm going to go ahead and put it in the hydrogen peroxide. I'm just going to let that sit for just a second while I get the scrubber. After that's sat, I'm just going to go ahead and clean the cannula. Make sure that's completely clean, and I'm going to dispose of the scrubber in the biohazard bag. And then I'm going to dip the cannula in the normal saline, and I'm going to tap it on the side of the box just to make sure that there's no excess fluid. I'm going to put it back in the site, making sure that I hear it lock, and then that's going to be done. So after I have put the cannula back in, I'm going to clean the stoma with the cotton swabs. So I'm just going to go around one time each, disposing in a biohazard bag. Disposing in a biohazard bag. Okay, after I've cleaned with the cotton swabs, I'm just going to go ahead and do the same thing with the wet gauze that I had sitting out from the normal saline. So I'm just going to clean the stoma and dispose in the biohazard bag. And the same thing. Once I have disposed of the last wet piece of gauze, I'm going to go ahead and get the dry gauze. I'm going to dry out the stoma area and dispose of the gauze pieces in the biohazard bag. Okay. After I've done that and cleaned it with the dry gauze, I'm going to remove the patient's strap. Ask the patient to lift their head up just a little bit. And once you've done that, you're going to remove the strap. I'm going to dispose of this in a biohazard bag also. After removing the strap, I'm going to go ahead and put a new strap on the patient. I'm going to go ahead and stick this through. I'm going to ask the patient to go ahead and lift their head up once again and pull the strap back through. And after I've got it through, I'm just going to go ahead and retie it. Don't want to do this too tightly, so I'm just going to stick 2 fingers under the strap, make sure that the patient has enough room to be comfortable. And after I have restrung the patient, I'm going to take off my sterile gloves and discard in the biohazard bag. I'm going to perform hand hygiene, and I'm going to get a new pair of gloves. After I've got a new pair of gloves on, I'm going to go ahead and get my cut gauze. I'm going to put that under the stoma. Being careful to pay attention to the patient's comfort. Make sure that it's not folded or anything that could cause any red spots. After I put the new gauze on there, I'm going to gather everything, take off my gloves, dispose of my equipment in a biohazard bag. After I've done that, I'm going to perform hand hygiene and remove the patient's bib. If there's anything on it, I'll go ahead and perform hand hygiene again. I'm gonna place the patient in a low bed position with the call light in reach, and that's it.